presentation is by the BCC3 team of Shelly Tognazzini, Davi and Tetiana Povshedna. Shelly has 16 years of lived and 12 years of work experience with the HIV community and research sectors. She's been an active contributor to the community, bringing her voice and lived experience to diverse spaces. Currently, Shelly works as a community research associate with the BC Karma Chiwos Collaboration Study, a 5-year women-centered community and clinic-based research project bringing together women living with HIV, researchers, clinicians, and community partners in BC. Davi Pang is a fellow community research associate in the BC Karma Chiwos Collaboration, where she works closely with stakeholders to recruit participants, facilitate workshops, and administer surveys. Her previous work with organizations such as the BC Yukon Society of Transition Houses and Justice for Girls have given her opportunities to learn, develop, and implement training programs and evaluate membership cycles, and contribute to impactful research projects aimed at empowering marginalized communities. Lastly, Tetiana Povshedna is a PhD candidate in the Department of Pathology and Laboratory Medicine at UBC. Her KM project, or Knowledge Mobilization Project, has been supported by the UBC Public Scholars Initiative since 2022 and focuses on strengthening the bidirectional relationship between research studies and communities that make them possible. The project meaningfully communicates personalized and, most importantly, actionable insights to research findings. And they also engage study participants during events which are co-developed with the Ribbon community, which was previously known as AIDS Vancouver. So I would like to invite the BCC3 team up to share their insights today. They'll be providing an overview of best practices in community-based research and the study's journey towards effective and personalized knowledge mobilization in the women's healthy aging research space.
Thank you, everyone. It's lovely to be here today. Man, it's bright up here. Okay. So yes, indeed, my name is Shelly, and I am a community-based research, or community research associate with the BCC3 study. As mentioned, the BCC3 study is a community-based comparative analysis of healthy aging in women in a 700 cohort study, 350 women living with HIV and 350 controls, or not living with HIV. So community-based research, in its true and best form, represents an approach to research that is conducted by, with, and for the community it aims to serve. It involves the active engagement of community members throughout the research process. As a woman living with HIV and employed as a community research associate, my responsibilities include the administration of surveys with participants, supporting data analysis, contributing to abstract writing, developing and implementing province-wide recruitment strategies, and sharing results with the community through knowledge mobilization events, conferences, and presentations like this one here today. For me, the most noteworthy, equitable practice of our study is the involvement of women living with HIV since the beginning of the study, guiding the formulation of research questions and providing invaluable feedback to the principal investigators and the team that only lived experience can. The collection of data and survey administration in a secure, meaningful, and ethical manner involves patience, compassion, and above all, listening to community feedback on an ongoing basis. Often through direct feedback, many women who face daily discrimination, stigma, and barriers to their own healthcare share how grateful they are having their voices heard and how much impact knowledge mobilization and personalized results from the study significantly bolster their advocacy for better clinical care. The training that we receive as community research associates, which began in the spring of 2020, is comprehensive, continual, and exemplifies the very best standards of community-based research in Canada today. That's my opinion, but I think I'm right. Including statistical training, data analysis, and even a tribute to the Cote Lab at UBC to see exactly where and how the biodata specimens collected are stored, as you can see on the slides behind me. Many institutions and academia not used to working so closely with community members are often surprised at the depth of training we have and continue to receive. This comprehensive approach engages the community from the initiation of the study through to the delivery of the knowledge mobilization full circle. And to that continuum, I'd like to pass it to my colleague Davi, who will talk more about knowledge mobilization in the HIV community.
Thank you, Shelly. Good to see everyone. Oh boy, it's very bright up here. So our knowledge mobilization journey began in the spring of 2021 with 7 art-based events in Vancouver, along with recruitment in Prince George, Victoria, and the Loon Lake Retreat in Maple Ridge. These events were supported by the UBC Scholars Initiative led by Shada Swan and focus on women's health through the Let's Talk series covering topics like menopause, immune aging, stress, and chronic pain. And as you can see on this slide, there are some pictures, artwork that was created by participants during our KM sessions and at the Loon Lake Retreat. Beautiful, aren't they? The series has since evolved into the Healthy Aging Talk led by Tetiana over here. We're covering topics like liver health and heart health. Our knowledge mobilization takes a unique community-centered approach. We've engaged over 200 women, both in person and virtually so far, by sharing early study findings through art interactive activities and using clear everyday language. This approach strengthens our connection with the community, and it ensures that information is to easy understand instead of complicated medical terminology. We created and customized health booklets for each participant. These booklets are more than just information, they are interactive tools. They contain results interpretation with tips on how to improve your health and QR codes for additional resources, including questions to ask your care provider. And also a clear marker, helping participants easily identify their specific health risks relating to the liver disease, decline in kidney function, heart attack, cortisol levels, and immune health. If we shift our attention just to the left there and have a look at the graph is designed to be simple to understand, showing age on the horizontal axis and using dots to represent women in the study. And as you can see, the purple dots for those living with HIV, and the gray dots are for negative controls. The background colors indicate different risk levels ranging from low to high, helping women understand where they are in terms of their health risks. And these booklets are available at the resource table. So make sure you stop by and have a look and take a few with you. Our knowledge mobilization has thrived in community engagement, demonstrating the impact of making health information equitable, accessible, relatable, and inclusive. And it's been such a wonderful experience leading these events. And with that, I'd like to hand it over to my colleague Tetiana to tell us more where we're heading next. Thank you.
We are almost done here. So what have you done in the last 2 years? With support from the UBC Public Scholars Initiative and UBC Community University Engagement Support Fund, and with our main partner, Ribbon Community, formerly known as AIDS Vancouver, we made a lot of progress. So we started with creating an employment opportunity for a study participant to make sure we have a participant's perspective in how we design and shape our events. Together, we co-developed 3 booklets on liver, heart, and kidney health, and for 2 of those, we already hosted 6 events. So for each topic, we hosted in-person event at Ribbon Community and 2 virtual events for women living with HIV and control separately to make sure that we can offer these events to women all around the province. In fact, we had women join from Penticton, from the island, and other areas of BC, emphasizing the interest in such events. So our liver events were in March, heart events in July, and our kidney events are happening this month and in December. Each event includes interactive trivia. All events are facilitated by the BCC3 Community Research Associates, and in the end, we have a Q&A session with a BCC3 study clinician. So the photo you can see on the left side of the slide is the Q&A session photo from the Heart Health event that was organized at Urban Community in July. And you can see Melanie and Shelly facilitating the event with Dr. King from BC Women's Hospital joining virtually. This part is particularly well received by the attendees because they appreciate an opportunity to ask questions about their health outside of the formal care setting. So these particular events engaged over 90 women to date, and of those 90, over 70 requested booklets, which we mailed or emailed based on the preference. And in the next couple months, we plan to organize 6 more events and engage around 200 women total in the project. On that note, I would like to thank everybody who makes this research possible, especially the participants who choose to share their stories with us, and the lovely faces on the left, which is the BCC3 study notes normalization team. Thank you.